Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, doctor. Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay, but basically, ideally, the seizures means it's due to the hypersynchronization of the brain. That means the brain are hyperactive. It becomes hyperactive in every neurons. So it produces an abnormal activity in all over the brain neurons. The patient will become unconscious, and patient will throw jerky movements of all four limbs, and the patient will also have an incontinence or fall or abnormal movements of the limbs and face and lips. This all will be the basic thing of seizure. The seizure can be divided into simple seizure and generalized seizure. If it is a simple, the patient will not lose the consciousness. Whereas in a patient with a generalized seizure, they will lose the consciousness. Along with that, they have a jerky movements of all four limbs and stiffness of all four limbs and sometimes tongue bite with associated incontinence of urine and associated with post-ictal confusion. They have a confusional state after the jerky movements and all that. And they will go for a post-ictal confusion for 5 minutes and then come back. This is the common type of seizures, what we call it as generalized tonic-clonic seizures, GTCS. Whereas in a simple seizure, the patient will have some jerking movements of a upper limb or lower limb or a face or a neck or any part of the body with full conscious sensorium of what they are doing. They can know what is they are doing, but they cannot stop the procedure, like jerking of the limb, like a twitching of a limb, like twitching of a faces, which comes and goes. So
Okay.
these are the common type of seizures, simple seizures and generalized seizures.
What is epilepsy?
So epilepsy means the same thing as seizure. Seizure
Mhm.
means the first episode when a patient become jerky movements and unconscious and a fall down and moving all four limbs. When it occurs for second or third time, it is called epilepsy. The first episode is called seizure. The second and third time it recurs means it's called epilepsy.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Epilepsy commonly it is 60% of the epilepsy it is due to idiopathic. That means still we don't know what is the basic pathology going on. And around 40% of the epilepsy is due to some intracranial lesion, like a tumor or a small cyst, or any sugar can be dearrangement, or sodium salts can be dearranged,
Mhm.
or any blood supply to the brain is inhibited, or any block or a hemorrhage inside the brain, or any vessels getting blocked inside the brain, like a stroke, or any infection and any head injury can produce one. And also any scar inside the brain can also produce seizures.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, epilepsy. Whenever the patient comes and tells you, they will come and tell, sir, we become. The patient was apparently normal this time. Suddenly, he was becoming altered behavior for few seconds, and then he had a uprolling of eyeballs and twitching of the limbs and hyperventilation, and there was a tongue bite was there, and jerking of all four limbs, and sometimes with incontinence of urine. This type of episodes, the patient attender will notice, and most of the time, the patient will not know what happened during that episode. There will be a loss of consciousness and amnesia of the event. Only the attender will took most of the history and they will tell what is going on during that episode. We have to have a history from the patient attender who saw that episode during that attack. Particularly, like the same thing as I said, they will be conscious. Suddenly, they become altered behavior and uprolling of eyeballs, jerking of the limbs, and stiffness of all four limbs. And there was a tongue bite, and hyperventilation will be there, and incontinence of urine. 4 minutes, they will go for a ictal confusion. They don't know what they are doing. And after a few minutes, for 5 to 10 minutes or 15 minutes, they come back to normal rhythm, means normal sensorium.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, what because the stigma is because particularly whether this carried out in the next generation when he gets married, whether he gets into the children's. That's what the people ideally think, and most of them they are getting into the adolescent groups, the children and the boys or a girl who are planning to get married, whether they go for the next generation or if they live a normal life or like that. So today, at the present, epilepsy has got a good drugs for treating it, and we almost control 90% of the seizures, and 10% will be 10 to 20% will be a refractory seizure, which is not responding to simple drugs. They may go for a surgery, or some genetic underlying pathology will be there, or some congenital anomaly from birth will be there, or some untreatable tumors which are repeatedly growing and coming back after removal of the, like a tumor which is like a malignant tumor which is not responding to the treatment. 80% of the seizures will be controlled with the drug, and they can have a normal life with a good drug responsive, like a diabetic patient living, and a hypertension patient living, and a normal uh, simple cardiac patients who are living on the living. They can also have a patient, people living with epilepsy with a normal life and normal children and normal day-to-day activities. The only restriction they should do is avoid night sleep deprivation, avoid night sleep deprivation. They should take regular medication as prescribed, and avoid screen time more than 2.5 hours per day, and also avoid any drug abuse like alcohol, smoking, and adhere to the drugs regularly, and follow up with a regular person who was treating him, and proper medications. They will have a normal life like a normal person, like a diabetic patient, have two children, get married, get the children also get married, and they can live a normal life up to normal lifespan.
How does this stigma affect people with epilepsy?
The stigma is what that same thing, man. Whether the new person who doesn't know about the epilepsy, a new person from a village side, or some they think that epilepsy is a ominous sign like that. They may think it is not a good sign. But we have to talk to the doctor. They have to bring to the person who is treating as a neurologist, for example. They will guide them the positive and negative things of epilepsy. For example, they can get married, they can have children, they can live a normal life, they can do the day-to-day activities along with the normal person with equally. And they have a good example. For example, John T. Rhodes, the big cricketer, the Napoleon, who has won all the war with the all sword previously. So many persons who are living at present, they can live a normal person and achieve a bigger, greater heights without any disturbance in the life. Just take regular medication and routine life as advised.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
The triggers is always have a good sleep. 7 hours to 8 hours of good sleep is a must, and avoid the screen time more than using continuously for 1.5 to 2 hours per day. And if he's working in the corporate sector with a screen in front of him, He has to use for 40 minutes and take a break for 20 minutes. And also, he has to follow the good night sleep and the day-to-day warm-up exercise like any other person for a good health. And the
Oh,
regular medication will be ideal to follow, whichever prescribed by the neurologist or a person whom he is following as a treatable for epilepsy.
thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Injuries during epilepsy.
Yeah.
Actually, whatever the patient, when you see a patient having a seizure, suddenly everybody surrounding becomes an anxious. That's what. But we should be calm, and what should be done in what you mean to say is when you see in the home or in a road, when you see a patient is starting having a seizure, a jerky movements and altered sensorium and unconscious with a tongue bite or uprolling, only thing, make him lie down in one side, left lateral or right lateral side, one side of the body he has to lie down, and put a pillow or a small pillow if it is nearby, elevate his head 30 degrees and
Yeah.
make him to lie in the left or right lateral side. Then only the tongue will come and fall to the side, and avoid any injurious objects nearby, because he should not get injured by the objects which is nearby, like a what is called any sharp object should be avoided. Any fall when he is lying down on the steps, or we have to pull it down away from the steps, or a risky height when you're in the height of the room, or nearby the water, you should pull him inside. So avoid him to get injured from the water or a sharp object or a fall down or a sharp injury from the a rod or a cart or a whatever it is on the wall. We should avoid the injuries. So pull him inside the room, give a wider space, let him have a seizure. It will stop on its own. Put him on the left lateral or right lateral side. Head and elevation should be done 30 degrees, and
Yeah.
if possible, remove the upper two buttons to get a good airway, and tap him front and back of the chest lightly to prevent his aspiration, and possibly, if as early as possible, to the nearby hospital. So don't give anything during the seizures in the mouth, because you'll aspirate and swallow it, and it will go to the lung, not to the stomach. We have
Yeah.
to give it in the nasal spray, or we have to give it in an injection or a rectal during the episode, and avoid an injury during that, keeping the surrounding clean and injurious places uh, neatly.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course.
Final call, epilepsy, first point, it is curable almost like 80 to 90% of epilepsy is curable.
Yeah.
And they have to take regular medication with proper physicians. And there is nothing, what we call it as, it is like a sugar and a BP patient taking a tablet and going to work and work like a normal person and can live with the normal population of everybody, 90, 100 years, depends on the age group.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.